Across the UK, the most common cause of cancer death is from lung cancer, and survival rates are failing to show any sign of improvement. So the question now, is a national screening programme the answer?
Let's take a look at some of the numbers. There are more than 46,000 new lung cancer cases in the UK every year. That's almost 130 cases a day.
It's the third most common type of cancer, and for every 100 people who are diagnosed, just 5 survive more than 10 years. And despite these numbers, the UK doesn't screen for lung cancer in the way it does for other cancers, such as bowel or breast cancer, although NHS England is running some pilot studies in London and the North West.
Well, one person who thinks a screening programme would save lives is the Conservative MP James Brokenshire. He took time off work after he was diagnosed in January and lead a debate in the Commons about the issue today. Very pleased to say he joins us now from Westminster. Mr Brokenshire, thank you very much for your time this morning. I wonder if you would just take us through your own personal story. This dates back to September of last year. You're on holiday. Just tell us what happened.
Yeah, late summer, I remember being out. I was out in Northern Ireland with family, enjoying some time with the kids. Had some lunch, realised I just needed to clear my throat, and the next thing I looked down was to see that I'd got a blob of blood in my tissue. Realising that, this wasn't right, pursuing this with my GP, being onward referred after I had an X-ray that was inconclusive, to a consultant, various different steps, and ultimately being told that I had a tumour in my right lung, a small tumour, but early stage, and therefore being able to have surgery as I did a few months ago. And you've highlighted these statistics, the fact that actually the death rates for lung cancer have been stubbornly poor, and that's because most cases that wasn't the situation. My situation isn't common. Most cases are picked up very, very late when the disease has already progressed onto other organs. And it's why I think that we do need a screening programme. We do need to be aware of some of the signs of lung cancer so that people can get the help that they need. And I think that screening people where we can pick things up earlier allows a much better chance to see that people can live longer lives, actually that curative surgery may be available to them. And that's why I'm leading this debate tonight.
Yes, and it's an important issue, isn't it? I just wonder, from your personal story, presumably this has been quite a big learning curve for you, and with you and your family as well. I'm just trying to picture some of those for those people anyone who's had cancer, or a family member who's had cancer. Yeah. Those moments in time, the first trip to the GP, the first time you tell your family that the realisation of the situation you're in. Just take us through what that's been like for you.
It's it's been hard. It's been really, really difficult. And I remember just those early days where that sort of sinking feeling in your stomach, the real pit of your stomach of what is this? What does this mean? And I think also recognising huge pressures on your family. My wife Kathy and the kids have been absolutely extraordinary at times where, you do go to dark moments. You do really think about, what does the future hold? But actually maintaining a positive sense around all of this. And yes, it is that uncertainty. In a strange way, once I knew what my diagnosis was, once I knew that I'd be moving into surgery, you can actually think, right, we'll get through this, we'll be positive about this. And I feel that I've been really, really lucky, had amazing NHS care from some extraordinary people. But having been through all of this, I sort of feel an obligation to try and bring about some change, some difference. It's notable that we have screening programmes, as you've rightly said, in things like breast, and yet more women will die from lung cancer than they will from breast cancer. And I think it's just some of these quite hard, stark facts which make me believe very strongly that a screening programme is appropriate. Yes, there are some really, really good steps that are starting to be taken, some pilots that are ongoing, work that clinicians are leading. But I think that we should be bolder. I think that we should take a step forward and move to a screening programme to ensure that more people are in a situation like me of picking up the disease earlier so that you can take action. You can ensure that it can be dealt with, and that we break some of the stigma linked to lung cancer, where people may feel guilt because they've smoked in not seeking help, or in cases like my own, where I didn't smoke, people may think, well, I haven't smoked, so how can I get lung cancer? Well, 15% of the cases are in non-smokers. So we need to challenge the misperceptions. We need to challenge the stigma.
Yes, I just wonder, Mr. Brokenshire, whether, given that you were a cabinet member of the cabinet and you had a prominent role, other people will have made a similar argument that you have made before, possibly from outside the Commons. So do you feel like, I know you said you feel like you're very much on a mission now.
Yeah.
Do you feel like you're coming up against some of the things that others would have pointed at you previously as a member of the cabinet and said, what about the money issues? What about when the health secretary turns around to you and says, I'm not sure if this adds up financially, not sure if we can do the sums. We're kind of with you emotionally, we support you, but here's the reality. You're probably going to come across that brick wall.
Well, actually, I think that there's a real opportunity at the moment. Science is changing, how we deliver healthcare is changing. Yeah, as a government, we have invested into the health service, extra billions of pounds that have gone in. But, we do need to look at the long term here. We do need to look at these new approaches like screening that actually are about saving people's lives, increasing their time healthily, and therefore the benefits of the health service of doing that. It's actually why I think we do need this long-term plan of looking at where the pressures are, the needs are, where new medicine is coming in. And, from my own part, I had a part of my tumour that's been sent off to some amazing DNA molecular analysis where we're better able to learn and develop new precision medicines to help patients do even better. So yes, things are changing fast, but on something like this, where 36,000 people are dying from lung cancer every year, 2/3 of those because it's late stage, I think that we do need to move forward with a screening programme. I think there's an increasing move towards this now, and what I want to do is to help encourage that, promote that, and see that change happens.
I'm mindful that Dame Tessa Jowell, of course, made a huge impact, didn't she, when she spoke about her own personal situation. I dare say today, being there with your colleagues, some of whom you've had vociferous arguments with over the years, that in itself is going to be quite emotional for you, is it?
Well, I was in that debate last week with Tessa and spoke in the debate, and the amazing work that Tessa Jowell has done in relation to brain cancer. And I think the thing that's really touched me is that colleagues from right across the House, it's a tough place, it's going to be an uncompromising place, but actually the support that I felt, the words of concern, the help from some people I might have expected, some people I didn't expect it to come from. And I think increasingly people are wanting to work together, to come together, to make a difference. Because, well, 1 in 2 of us will get cancer at some stage in our lifetimes. It's about us, it's about our friends, our family, our brothers, our sisters, and actually making it real. And I hope in a small way that's what I might be able to do by, yes, talking about my own personal situation, the challenges of going through surgery, going through a diagnosis, what that means, the impact it has on you and your family, and that we can really shift the dial on some of these survival rates, get people to get help sooner, get help earlier, recognise the signs, and therefore ensure that we can really help beat cancer together.
James Brokenshire, thank you very much for your time this morning. We wish you well, and of course that debate will be happening later on, early evening this evening in the Commons.